You guys are paramedics. You're called code 2 for a lift assist with weakness. You arrive to a small apartment complex, second floor of an elderly living community. It's a crisp 8:45 in the morning on a beautiful sunny day. The neighbor flags you down and says, I don't know what's wrong with her. She's normally out every morning watering her flowers, and she wasn't today, so I came to check on her, and here she is. You walk into the apartment, and you see an approximately 350-pound female who is in her mid-60s.
Okay.
Seated as you find her, there's an obvious odor of urine and feces, and your patient is visibly pale and diaphoretic.
Okay. This is my only patient then?
This is your only patient.
Okay, so VSI, my scene is safe, correct?
Your scene is safe.
Okay, so second floor, elderly apartment. How old is she? 60s, 70s?
65.
65 and 300, over 300 pounds. Okay.
300
Do
pounds.
we have a name?
Her name's Betty.
Hey, Betty.
You want fire on the way?
Do I have additional resources coming, or is it just
No,
just
you guys
us?
got called code 2 for lift assist.
For a lift assist? Okay. All right. And unwitnessed, correct? Just the neighbor found her like
The
this?
neighbor found her in an apartment like this, yeah.
Okay, so Betty, so skin signs, she's obviously in distress, so I'm gonna go ahead and we wanna put oxygen on her right away. Do I see any notable trauma?
Nope.
Okay, no bleeding?
Nope.
Is the laceration I'm seeing actually,
Nope.
okay.
And
Okay, so
neither is
she's,
the penis.
well, yes, she does. Good to know. Okay, so Betty, is she able to talk to me?
She does not track you as you walk in.
Okay, so we're gonna put her on. We're gonna put her on oxygen for sure, and we're gonna get a set of vital signs. So we want blood pressure. Is she able to talk? As I'm talking and we're touching her, is she
She
able
does
to?
not respond to verbal.
Nothing. So I'm gonna go ahead and lay her down.
Okay, she's 350 pounds covered in poop and urine.
Yeah. But I kind of want to see what's going on behind her too, to see if there's any, if she fell. Is trauma evident at all? Like, am I able to see behind her? Was she
Her
leaning
back
back?
is suction cupped to that wall.
Okay. Okay, so Betty, we're just gonna kind of just do a physical to see if there's anything. I'm not noticing any
No
trauma.
trauma.
No trauma. Okay. All right. So let's go ahead and listen to lungs. Okay, I'm gonna listen to her lung sounds. Am I hearing anything?
You hear clear and equal lung sounds in the upper lobes
Okay.
and slight rails bilaterally in the lower lobes.
Okay. Is the neighbor able to give me any history on that? Is
I just know she has a bad heart. I'll look for some medications.
Okay. So considering probably CHF if she's asleep. So we're gonna look for those medications then.
Okay.
Do I have a blood pressure yet?
Still taking it.
What's my SpO2?
Is it on
Turn
her?
it on? No.
Blood pressure is 76 over 40.
Okay, so SpO2 going on her finger. Okay, I'm gonna go ahead, hook her up to the monitor.
Jesus Christ. I'm just exploding.
Okay, we're gonna get an IV going. Find that list of medications.
Yeah, I found it.
Okay, could you rattle it off to me?
Yeah, it says here Lasix, HCTZ, atenolol, Crestor, Vicodin, Ativan, Metformin, Humalog, Novolog, Paxil, Effexor, Celexa, and Abilify.
Okay, definitely see if it's patient. Okay, so,
Don't put the stickers on them.
okay, so we're gonna do,
Gotta do this thing.
definitely wanna do a 12 lead.
Okay.
Start an IV.
Are we poking arms?
want a real one?
Yep.
We don't have caps.
Do not
What's my-
have 12 lead for this call.
Okay.
But you can put the stickers on her if you want, and I can tell you what it says.
Okay. Do you mind go ahead and getting stickers for me?
Yep.
Based on our history, I'm gonna go ahead
Just
and
pantomime it.
consider CPAP as well.
1, 2, 4, 3, 6, 5.
Okay.
You want CPAP, you said?
Yes, please.
Your 12 lead is analyzing.
Okay.
Analyzing.
I have alcohol prep. Was not in our.
Is that fluid bag or ready for you?
Gonna go in a sharps container, if I have one. We're gonna consider we're in.
Okay.
Flush. They didn't put anything back, did they? We're gonna taxiderm it. Okay, what's my monitor showing?
Your 12 lead shows this rhythm throughout with no obvious ST elevation.
Looks like we have a heart block. 3rd degree? Is that what we're showing?
If that's your interpretation, that's your interpretation. Can't tell you what it is, unfortunately.
Okay. Okay. How's my patient's mentation? Is she able to communicate with me at all to try to get that CPAP?
Have you gotten her response to what stimuli yet?
Verbal?
She's not responsive to verbal.
Okay. How about stimuli? Any kind of physical, nothing, she's not
You
responding
didn't
to
try
us.
it, so. She responds to painful stimuli and says, "What's going on?"
So she responded then to my IV as a pressure?
Sure.
Okay. Okay, so Betty.
Yeah.
Okay, Betty. Okay, so we're just gonna, I need you to take some deep breaths, okay?
Okay, I feel woozy.
Okay, we got high flow going, CPAP. She's, okay. How many pills were left in her bottle? Has she been taking them?
It appears as though she's been taking her medications as prescribed.
Okay. Okay, so we are going to definitely want to transport this lady, but we didn't have any other resources
Fire
on the
department
way.
will be here in 1 minute. You can hear the sirens.
Okay, so we're definitely gonna wanna put her on a, definitely not on a chair.
She's 37.
Jeez.
You gotta get that.
Really
You gotta
woozy.
get that pace up. She's symptomatic.
Okay,
Got pads over there.
thank you. Okay. Can you take another blood pressure for me?
Yep.
It's not regular pads.
Fine, you can.
Okay. So we're gonna put pads on.
Can't mind that.
Okay. Okay. Pads are gonna go on.
You're gonna place the pads, okay?
What's her oxygen?
On the CPAP is a 94.
Okay, so that's a plus. Listen to lung sounds again. Couple minutes on CPAP, are we having any improvement?
No change in lung sounds.
Okay.
New blood pressure is.
New blood pressure is 68 over 38.
Well,
Rate
heart
down.
rate is still 37. So we're
As
gonna,
you see it.
so we're gonna wanna pace her. does. So just go to pacer.
Okay, just walk me through how to pace somebody and I'll do it for you.
Okay. Well, I can tell you I'm not super familiar with it, so
Okay.
does
Does
my,
your partner
can
know
my
how to
partner
do it?
help me with this?
Yeah,
I've
your
never
partner-
paced
your
anyone
partner can do it.
before,
Second.
so,
Hit the
Okay.
sync button on off.
okay. And it's gonna capture, is that correct?
We have to turn the joules or watts, whatever it is, I'm not sure.
Okay.
These ones are
So we
a little
wanna
bit
usually
different
do-
from me too, so
So maybe
async pace.
80? Or do we wanna start at 70?
Start low, go up.
Okay. Let's go.
So that's not the milliamp side, that's the
Okay.
minutes of this is the milliamp side.
Okay.
Yeah, now you see
Okay,
the
gotcha.
milliamps going up.
So you want electrical and mechanical.
So it'll. And go to. What would you do in this, like, what would we put the amperage at?
So how do you pace?
I've never done it.
You don't, there is
So-
no set number, you just gotta capture electrical
Right.
and
Okay.
mechanical.
Okay. So we just keep moving it up until it captures?
Yep.
Yep.
And then we'll still see the pacer spikes?
Yeah,
Right there. Okay.
Keep going up.
Just keep going, don't be shy.
Okay.
I'm not sure what button. Okay, so
Anyway.
you have electrical capture. There
Okay.
you go.
Okay, so we see pacer spikes. So it's pacing at 70? Is that what we're seeing then?
Yes, it is pacing at that rate
Okay,
now.
perfect.
Okay.
Okay.
What are you going to check for when you have electrical capture? You confirm electrical and
Mechanicals.
mechanical. Yep,
Okay,
you have
and it's
mechanical
confirmed.
capture corresponding with the monitor. Yep.
Okay.
Is fire here?
Let's go ahead and take a blood
Fire's
pressure
here. Hey, you
again.
guys, what do you need?
So we need to get this lovely lady out to the ambulance.
Okay.
Stair chair.
So let's cover a stair chair and a blanket and
Go get your stair chair and your blanket.
get her up. Try to keep her sitting up because she's obviously. Let's do another blood pressure, vital signs check. What's her SpO2 on my monitor? Still stating in the
94%.
94? Okay. Vital signs. How is her lung sounds again?
Unchanged.
Okay. We'll look at that blood pressure, and then we'll move her onto the stair chair. Get her out to the ambulance.
Do you have fluids running in her or not?
I'm gonna keep the fluid. I'll wait to see what my blood pressure is. Blood pressure is complete. What do we got for my next step?
72/50.
So we could probably do a 250 bolus, just to keep her pressure up, but we don't wanna overload her.
Yeah.
Okay? And we're gonna do a code 3 transport. So we're gonna get
Okay.
fire to help us.
So your patient has been extricated and is now in the ambulance.
Okay. So we're going to do our best to keep her sitting up and do another set of vitals in the back of the ambulance as we transport.
Okay, so you have a community hospital that's 10 minutes away with no specialty care, and you have a level 3 trauma center that's 20 minutes away that has cardiology, neurology, and ortho.
How far is that one? 20?
20 minutes.
No specialties at this.
Are you worried about losing an airway?
No, her respiratory seems to be fine. She breathing normal with CPAP assisting?
Yeah.
Okay, her SpO2 is 94 on the CPAP. I think we could just go to the 10 minutes, just go to the closest hospital.
Okay. Code 2, code 3.
I'd go code 3.
Okay, do you want a rider?
I'm gonna keep my partner and have fire drive for me if that's acceptable.
That's acceptable.
And gonna reassess again, full check. Cardiac's maintaining at this paced rhythm.
Yes.
Okay. SpO2 is still maintaining 94, or did we improve?
94.
Okay, we're gonna get another blood pressure. Betty coming around a little bit more as her mentation. Is she talking to me?
She
fighting anything?
has been able to talk to you
Okay.
this whole time.
Okay.
She says she feels woozy.
Okay, so is any nausea or vomiting?
No, not really.
Okay. Just dizzy. Okay. Okay, what's my new blood pressure?
Your new blood pressure is 72/46.
So we definitely, fluids are not helping, so. Guess we can do some sort of,
Hypertensive, fluids don't help.
pressor, right? So we could do dopamine. Do a drip.
Okay.
Which is 2 to 20.
Yeah, that's why I wanted him.
Okay, so if I had a drip, yes, but I don't have any tubing for medication, so we didn't do a dopamine at 2 to 20.
It's okay, we can verbalize it. You don't need to
Okay.
get a drip and puncture the bag or anything.
Okay,
Okay, so 2 to 20, what's your dose? Your patient is 350 pounds.
so it's gonna be, let's just shoot for 10. It's gonna be 10 micrograms, right, per kilogram?
Mm-hmm. 350. Roughly 150, 160, still 150 for using that.
Do you need a new pen? Just for
No,
now?
I just keep breaking this one.
You out frustrated? Okay, so we're gonna do
160.
so 160. So 160. I need to be able to do math in my head. Okay. So 10. 160. So 1600. So we're giving the whole bag,
No,
right?
1600 mics per
Grams
mil.
per milliliter.
So we gotta give 1 mil.
Okay.
You gotta give 1 mil per minute.
Okay, and we got a 10 minutes. So we'll give 10 milliliters for the transport.
What's your drip rate gonna be?
60 drip tubing.
So 6 drops a minute.
So if it's 60 drop tubing
Over.
and you need to give 1 milliliter a minute, how many drops a minute?
Put that away. It's easy.
Okay.
Partner can help. He's in the back.
Okay.
60 drop tubing.
Right? So
This is
basically 1 drop
1600
per
mics
minute.
per milliliter.
Right.
We want to give 1 milliliter.
Okay.
So it's 60 drop tubing, so we do 60 drops
Drops
per
per
minute,
minute.
1 drop a second.
Second. Okay.
Alright, so you got
Thank you,
your
sir.
dopamine drip going at 1
Yeah.
drop a second. Good job.
Okay. And then we're gonna go ahead and give a rated report.
Okay, this is Matt at Ross. We'll go ahead with your radio report.
Okay, Mad River, Medic 1, coming to you, code 3, with, what did we say, 65? 65-year-old female, approximately 160 kilograms. Chief complaint, shortness of breath, weakness. Arrived on scene to find her altered, incontinent of urine and stool. She's currently on the monitor at a pace rhythm of 70. She's CPAP. Lungs are, they were clear, but what are they, rails lower lobe?
Mm-hmm.
Okay. Lower lobe, lungs, we could hear rails clear on the upper lobe. We currently have an IV established in her right AC, and a dopamine drip is going. Last vital signs, what was my last blood pressure?
I just took it again, but I didn't want to interrupt you.
96/54.
Okay, so last blood pressure of 96/54. SpO2 is 94 on CPAP. And if you don't have any questions or orders, we'll see you in about 5 minutes.
Okay,
That was
see you in
horrible.
5. Is there anything else you'd like to do for this patient?
Not as of now, because I probably already killed her.
We'll talk about that. Okay.
Yes, please.
Alright, in scenario